Did you know you could go 3 weeks without food, 3 days without water, but only 3 minutes without oxygen? That's why airway-focused dentistry is so important. When it comes to airway, it's not getting better. Unfortunately, the way that we're evolving, it's only gonna get worse. Our jaws are getting smaller and smaller, and our airways are following. Within 1 generation, we can see the changes to jaw size and function. We're seeing teeth crowding progressing very rapidly through the last few hundred years. The modern world that we live in is working against us with all of the toxins that we're exposed to in the air, the pro-inflammatory foods. Everything is contributing to the fact that we are more inflamed than we ever used to be. We're chronically congested, and we're becoming chronic mouth breathers. In the modern world, our diets are softer and more inflammatory than they've ever been. This has led to our muscles not having to work as hard to eat and process our foods, which has led to jaw development being delayed, stunted, and smaller. This is how we've evolved across the board. With that comes smaller airways and more likelihood for children to have sleep disordered breathing issues that lead to adults with sleep apnea and chronic illness. Anything that leads us to breathe through our mouth instead of our nose, whether it's an illness or a pollutant, is going to decrease our quality of life. Our body was designed for nasal breathing. We don't get the proper filtering and conditioning of the air that goes to our lungs when we breathe through our mouth instead of our nose. Over half of children by the age of 9 are chronic mouth breathers. This is gonna lead to underdevelopment of the jaws and narrow airways. Conventional tooth-focused orthodontics is not idealizing our airway and our jaws for breathing. What we know as airway-focused dentists is that when we do orthodontics, we're expanding the jaws and not only making the teeth straight, but making the jaws large enough to support the tongue so that the patient can breathe properly. When we do conventional orthodontics, a lot of times we're treating them too late in life, and their jaw bones are already grown enough that they can't come downward and forward as much as they need to, leading to severe crowding that can only be treated through extractions. These extractions make everything even worse because now we're constricting their jaws and narrowing their arches even more so that there's no room for their tongue. The phrase that a child is gonna grow out of their sleep disordered breathing is commonly thrown out by pediatricians and orthodontists, pediatric dentists, all doctors alike. And that's purely because they don't know that there's things that we can do to improve this condition. But evidence has shown that kids will not grow out of these issues and they need early intervention to correct them. Most of the time, it's due to that improper tongue position or a tongue tie. And if we don't address that early on through myofunctional therapy, tongue tie release, and expansion orthodontics, they're not going to catch up. Once a kid is a couple millimeters behind, they're not naturally going to grow anymore without our help. I see a lot of children where we're taking measurements of their jaw each time they come in for treatment. And then there's some children that don't get treatment as early as others. And we note in our chart that their arch width has stayed exactly the same every single time they come in. We know that if we don't do something about it, they're not gonna get better. And we also know that the sooner we do something about it, the higher chance they're gonna have of growing into the best version of themselves and not needing surgery later to prevent them from having chronic issues. Please follow me and watch more of my videos.